that we cooperate and that we collaborate and not go it alone. Griffith University is honored and delighted to co-host this event. And from its beginning over 45 years ago, it has been committed to environmental sustainability as one of its priority concerns and to interdisciplinary problem solving and international partnerships as key principles to guide teaching and research. We have taken the whole of university approach to pursue sustainable development throughout all of our faculties, from health to science and environment to business and law to humanity, arts and education. And social justice and social license pervade a lot of our activities as we go forward, because that really has to be the key, where we look at in detail human thought and behavior and how we affect peoples. And we cannot lose sight of that important mission. During the last decade, one of Griffith's research focuses has been on the impacts and adaptation to climate change. Our environmental and social scientists, engineers, urban planners, city researchers, rural researchers, water experts, health and legal experts across various research centers are working to develop cross-disciplinary solutions to a range of climate change challenges through the university's strategic investment in climate action research. We are in the midst of development of a new research and innovation plan, which will stress interdisciplinarity and will give even greater prominence to bringing together the disciplinary expertise to create impact. Thus, it is particularly fitting that the Griffith Center for Environment and Population Health is a co-host for this event. It was established in 2006 as a research and capacity building academic center to work with international partners to address pressing global health threats. Its current focus is on linking disaster response and climate action in safeguarding global health security and to facilitate cities, hospitals, communities in adopting sustainable policies and practices. These are easy words to use, but walking the talk is much more difficult, and putting these into practice is really the challenge. So I look forward to working with our researchers to embrace that challenge. Climate change, I don't have to tell all of you, has become a serious concern around the world, especially in this time of uncertainty and pandemic and geopolitical jockeying. As the climate changes, health security issues, including bushfires and droughts, floods and cyclones, emerging infectious diseases and pandemics, and food and water security, all increase the scale and spread of human suffering. And this illustrates the intersection of all of the UN Sustainable Development Goals, because they are not existing in isolation, and they should be viewed within that context of intersection and interconnectedness. So it's clear that we require urgent climate action to mitigate, better prepare, and manage the risks. And yes, adapt to the risks. Indeed, there is no doubt that climate change and its associated impacts present a great challenge to the world today and will, unfortunately, increasingly do so in the future. Without improving capacity and becoming better prepared, health systems worldwide will struggle to cope, as we are seeing in the last few months. The immense challenges ahead make working together in the healthcare sector across states, and regions and countries more important than ever. To this end, a key purpose of this event is to provide the opportunity for us to strengthen research partnerships and international cooperation for urgent collective action. Griffith University is ready to do so and is proud to support this event and associated initiatives in recognition of the importance of our collaborative work, which is needed to ensure regional health security and sustainable development. As the Deputy Vice Chancellor of Research at Griffith University, I am proud to see that we are playing a meaningful role in tackling climate change side by side with global partners in an informed way so that we're not working in isolation. Finally, on this World Environment Day 2020, I represent Griffith University in expressing our strong support to join hands with the hosting partners and the healthcare sector in this region and in other regions in calling for the world's attention and urgent action to address climate change impacts, including strengthening international cooperation to be better prepared for future pandemics and other challenges that might come our way. So thank you once again all for attending this event, and I wish you well in your deliberations, in your conference. So thank you once again, and all the best to all of you. Thanks, Fiona.
Thank you very much, Professor Pinto, for those inspiring remarks. It's my pleasure now to introduce the lead organisations for this event. Healthcare Without Harm, Southeast Asia, is part of an international network of hospitals and health systems working towards a sustainable healthcare system and environmental justice. The International Network of Health Promoting Hospitals works towards better health gains by improving the quality of healthcare, the relationship between hospitals and health services, the community and the environment, and the conditions for and satisfaction of patients, relatives and staff. Griffith University's vision is to engage in remarkable scholarship and research that contributes significantly to society. Griffith is a progressive and highly respected university dedicated to learning, leadership and innovation. And my own organisation, the Climate and Health Alliance, is a national coalition of health groups in Australia whose mission is to build a powerful health sector movement for climate action and sustainable healthcare. I'll provide a quick overview of the agenda for everyone now. Next, we will see a video presentation from Healthcare Without Harm, Southeast Asia, from World Health Day 2020. Then we will hear from Dr. Renzo Guinto. We will then hear from Dr. Nguyen. We will then have opportunity for Q&A from our two keynote speakers. Pats will then organise another set of questions for us in an interactive prompt, and then I'll hand over to my colleague Ramon San Pascual to moderate the panel discussion. The panel discussion will discuss challenges and opportunities on the climate and pandemic crises, and we will hear from Nurse B. Ling and Frank Ramalou on the panel. We will then hear Pats will produce another video presentation of healthcare professionals from Southeast Asia and the Pacific. We will have another Q&A session for all speakers, and finally we will wrap up at the end. So now it's my pleasure to hand back to Pats for the video presentation. Thank you, Pats.
Thank you very much, Fiona. Just a few minutes. Thank you.
Thank you so much, Pat. Absolutely brilliant and inspiring and very useful at this moment. It's my pleasure now to introduce Dr. Renzo Guinto Dr. Renzo is a Filipino physician and Chief Planetary Doctor of PH Lab, a global think and do tank for advancing the health of both people and the planet. Renzo is an Obama Foundation Asia-Pacific leader, an Aspen Institute New Voices Fellow, and he recently finished his Doctor of Public Health degree at Harvard University. Renzo is also a member of the editorial advisory board of Lancet Planetary Health, advisor to the Forum on Climate Change and Health of the World Innovation Summit for Health, and Next Generation One Health advisor of the Lancet One Health Commission. Previously, Renzo served as Asia coordinator of the Healthy Energy Initiative in Healthcare Without Harm. And before I throw to you, Renzo, I'm just going to remind you and Dr. Newman, we're excited to hear from you, but we urge you to keep to time so that we have time to engage in Q&A. Thank you so much, Renzo.
Thank you very much, Fiona. Can you hear me?
Yes.
Wonderful. So don't worry. I know you're a very strict cop, so I'll make sure I'll stick to time. And I hope you can see my slides now. Again, happy World Environment Day, and it's not our usual World Environment Day. No street marches, no tree planting activities, no press conferences, but we are grateful for the gift of technology. And despite the economic shutdowns and societal lockdowns, we can all gather in this moment to talk about the pressing issues of our time. And I just want to remember as well, a while ago, Professor Pinto led us in remembering and honoring our ancestors. I also want to remember all the victims and the frontliners that are gravely affected by COVID-19 before and even until today. And we really dedicate this presentation and this entire convening to all of them. For the next 15 minutes, I just want to share with you some thoughts, some initial prompts and themes regarding the intersection between COVID and climate change, between the health of people and the health of the planet. And I entitled here my presentation, Flattening the Curve, because I believe while we are flattening the curve of COVID-19, we have to take advantage of this opportunity to also flatten the curve of our emissions, our ecological footprint, in preparation for a much healthier and more sustainable post-COVID future. I would just like to remind the crowd, and I believe we have several friends here who are already in the climate and health community. This just shows to you how climate change and human health are deeply connected. And climate change is going to result in many different health outcomes through a diverse range of pathways, from storms and typhoons in the Philippines, how they lead to injuries and even deaths, to drought and extreme heat that lead to undernutrition and exposure to intense heat, leading to heat-related illnesses, heat stroke, etc., and even mental health. There's growing evidence that mental health is aggravated, but our mental disorders are aggravated by exposure to various climate-related factors. So this is indeed a great global health challenge that we are already facing now, and we are about to face in the years and decades to come. And indeed, there has been a lot of research and reports that have been published, and this is just a sampling of the numbers. And I hope not to scare you. We're already afraid of COVID-19 as it is right now. But from 2030 onwards, for instance, 250,000 deaths annually due to climate change. This is a conservative estimate. And at the bottom, you will see around $30 billion health costs due to climate change, again, annually as climate change ensues. And we know, and we already heard a while ago, this the equity dimension of the COVID crisis. Even when it comes to climate change, it is as well an equity and justice issue. This is the classic map from the World Health Organization. At the top, you will see the countries, the regions that have been enlarged and magnified. These are the parts of the world that unfortunately emitted the greatest amount of greenhouse gases over the past century. But at the bottom, you will see the parts of the world that unfortunately will be bearing the brunt of climate change, the health burden and suffering. Africa, parts of Asia, and I always say the Pacific will, of course, they're already affected now by climate change, but they're too small in the map to be magnified, or unfortunately, maybe by 2030 and beyond, they will be even disappearing from the world's map because of sea level rise. And I know we have Australian friends here, but I cannot find a map that includes Australia. But here you can see Southeast Asia being really a climate hotspot. And the redder the country is, the more vulnerable to climate change it is. And as you can see, my country, the Philippines, is the reddest of them all. But as you can see, its neighboring countries are definitely not immune to climate change and its various health effects. And of course, we know that climate change, or Southeast Asia as a region, is collectively vulnerable to climate change and its health effects. But we have also seen in the past few weeks and months, actually, that the region is susceptible to emerging infections. Before COVID-19 was transferred from Wuhan to Europe or the United States or even Latin America, Southeast Asia was its first landing location. And as we know, there has been a mixed, if the COVID response of Southeast Asia were a movie, it's a mixed review. You're seeing countries that are showing, that have mounted effective and early responses, but at the same time, you also have neighboring countries that are not so much doing well in terms of preventing cases and reducing the risk of death. And here, I just want to update you that there's already 6.6 million people already affected by COVID-19, around more than 380,000 deaths. And unfortunately, these numbers, we expect them to grow in the coming weeks and months until we find the vaccine. And I'm sure we're all asking, is COVID-19, is this coronavirus linked to climate change in one way or another? Let's try to investigate. But I'm grateful to Healthcare Without Harm for setting the scene through that video that you showed a while ago. Indeed, there are many links that we can identify. And of course, the first one is with regards to the source of COVID-19, SARS-CoV-2, the infectious agent responsible for the pandemic. We know that a warming planet provides a conducive breeding ground for infectious diseases, the reemergence of old ones, and the emergence of new and even unidentified ones. And there have been studies already showing that even Ebola in 2014, Zika in 2015, 2016, there are strong links with a changing climate. But also it's not just climate change, that is the environmental link to COVID-19. We know that our, quote-unquote addiction to meat consumption and the consumption of wildlife for various purposes at large has a very strong contribution to this pandemic. As you can see, the suspected source is this market in Wuhan, where and we know that with increasing wildlife consumption, with encroachment of human habitations into natural ecosystems, the links between animals and humans are being tightened all the more, which provides a good source for emerging infections. And I'm sure you've heard, and for the past few weeks, we've added a lot of new terms into our lexicon. Zoonosis means diseases, infectious diseases that are transferred from animals to humans. Here you can see an invisible small microscopic virus can be spread around the world in just a matter of days, weeks, or months when we increase our connection and our interface with animals that are the carriers of these diseases. Of course, it's not just the source of COVID-19 that has strong links with climate and environment. Now we are seeing that our health systems are really unprepared, whether it's for an infectious disease pandemic or even for the much longer and much chronic threat of climate change and its health effects. We're now seeing the Italian health system reaching near collapse, the U.S. health system right now under the state of shock, and also our health systems in Southeast Asia feeling and bearing a lot of pressure from COVID-19 and also the unintended consequences of the disease and our response to it. And of course, another aspect that links COVID-19 and climate change in the environment is the environmental impact of our collective response to the epidemic. And of course, in the initial phase of the pandemic, it's understandable when environmental considerations are probably not top of mind, although that needs to change. Environmental considerations should always be top of mind in everything that we do. But of course, now we're in month 3, and it's important that we start investigating how we are actually creating new kinds of pollution as part of the response. And as you can see, surgical masks being seen along beaches, in seas and lakes, and the organizations such as the Healthcare Without Harm are instrumental in making sure that healthcare abides by green sustainability practices, so that we don't become accomplice to the crime of climate change and environmental degradation. And of course, here you will also see, in the news that air pollution is in its all-time low. Coal-fired power plants shut down temporarily in China and many developing countries. And indeed, there is some decarbonization that has occurred in the past 3 weeks alone. Here, in a very recent study, you will see a very clear and prominent dip in reduction of carbon emissions over the past 3 months, even reaching 2010 levels of emissions, as you can see in the map. And then here you will see that the sources of the emissions that we have seen over the past few months are, the halting of surface transportation, cars, in particular. Industrial emissions have been reduced dramatically, and even from the power sector, as you can see. But of course, yes, we are enjoying blue skies and cleaner air and breathing cleaner air. There are even fake news circulating that dolphins have showed up in the canals of Venice. But I think we need to take this with a grain of salt, or even with a pound of salt. And let's not romanticize the seemingly apparent environmental benefits of the pandemic. This is not how decarbonization should work. We don't want decarbonization through a pandemic by having a virus circulating, killing lives, and stopping economies and exacerbating inequalities. That is not a good option. And the better option is decarbonization that is planned, that is gradual, that is intentional, that considers its side effects, the economic and social unintended consequences, and making sure equity is front and center. And of course, while we are grappling with a global pandemic, climate change has not stopped. Despite the initial 3-month respite that we have given Mother Nature. And here in this another very new paper, it just shows to you that in the coming months, these are the climate-related hazards that we should expect while we are fighting COVID-19. And you know, in the Philippines, for example, the typhoon season has actually started already. And once the summer season has returned to Australia, unfortunately, we can expect to see the bushfires that we've already witnessed in January in your country. And so the question that we need to ask, and I believe we are all in the health sector here, are we ready to build health systems that consider not just COVID-19, but also the climate? And here you will see me talking to communities that are already affected by sea level rise in the Philippines. And now is the time to really expand the vision of the health community from public health, the health of people, to planetary health, the health of people and planet. Those are our patients now in this age of COVID and climate. And I just want to actually pay a tribute, a homage to a great Australian, Anthony McMichael, the first one to actually frame climate change as a health issue. And he says here that the health sector must lift its gaze to bigger ecological horizons. This will require a radical extension of the public health agenda, and I think that is planetary health. New forms of professional training in environmental health, a preparedness to base policy advice upon predictions and best guesses in addition to empirical data, and an ability to collaborate with unfamiliar disciplines such as climatology and ecology. And, you know, it's a call for us health folks to start talking to other disciplines that we are not taught to interact with back in medical or nursing school. And this is the vision that we have, not just for Southeast Asia, but for the world entire. In the 21st century, health systems should be universal, accessible to all, high value, provides high quality, safe healthcare that makes everyone satisfied, but also climate smart. Again, not just climate resilient, adaptive to the effects of climate change, but also low carbon, because as I've said a while ago, we don't want to be accomplice to the global crime of climate the climate emergency. And of course, we want to be pandemic resistant, as we can now see in COVID-19. We can detect early, we can respond quickly, resources are ready, and we can lead to better recovery. And so, I'm reaching to the end of my presentation, and I just want to show to you some of the emerging discourses right now around, climate change, COVID-19, and planetary health. I think it's also time now for a global Green New Deal and a healthy recovery. Now we're seeing there's a growing movement within the health sector calling for, economic stimulus packages to not just be green, but also to be healthy, investing in health and health systems, and also in green, in greener economies, green energy, green future. We know that COP21 has been postponed from to 2020. COP26 rather has been postponed to 2021. It's supposed to be in November this year in Scotland. Now it's going to happen next year. And there's a lot of discussion now about how can we turn COP26 into a health COP. And we know that in the Paris Agreement that was signed in 2015, there's only one mention of the word climate change. And now now is the time, how can we turn health from a side event to an overarching frame in the future of climate negotiations and climate action? Professor Pinto reminded us a while ago about the Sustainable Development Goals. We only have 10 years remaining, and now COVID-19 has put a halt to global progress towards achieving the SDGs. Can we still achieve them? And is this still the right blueprint for the post-COVID future? Health is there, goal number 3. Climate change is there, goal number 13. But we have other goals that we need to achieve, and we need an integrated approach to addressing all of these in the future. And finally, we love using the term new normal. There's really nothing normal in the pre-pandemic state that we came from. And really what we need to start talking about is how can we renovate the political economy of planetary health that creates climate change, but also makes us more susceptible to COVID-19 and other infections. How can we shift from this growth model, limitless growth model of the economy to an economy that meets people's needs but does not violate the planetary boundaries? And you can see there the donut economy model put forward by the economist Kate Raworth. So it's time to flatten the curve, not just of COVID-19, but also of our emissions. And I'm sure this is the most famous graph that is circulating in social media these days. The healthcare's capacity can be increased. The Earth's capacity, as you can see there, that's non-negotiable. That you cannot change. And so we are the ones who need to adjust and to make the changes so that our ecological footprint gets flattened. Because if not, and now there's a lot of talk about when is the second wave coming? When is the third wave of COVID-19 coming? There is a much bigger and much scarier wave that is about to happen that we can anticipate if climate action will be delayed in this day and age. So together, let's advance the health of people and planet. Thank you very much. Looking forward to a very energetic conversation. Thanks, Fiona.
Wonderful. Thank you so much, Renzo. And thank you, Renzo, for, as always, addressing and making sense of an extraordinary range of complex issues in a compelling way. I can see in the chat people are really enjoying it. I'd just like to remind people before our next speaker that we'd love to hear your questions and comments. So please use the chat box to post questions there to either of our speakers in this session. It's my pleasure now to introduce Dr. Nguyen. Dr. Nguyen is currently the Director General of the Vietnam Health Environment Management Agency in the Ministry of Health. She has 15 years of experience and diverse capabilities in leading and supporting the development, enforcement, and implementation of policies on environmental and occupational health, environmental protection in healthcare facilities, and the health sector's response to climate change, including executing a number of projects funded by WHO, UNICEF, United Nations Environment Programme, Asian Development Bank, and the World Bank. Welcome, Dr. Nguyen.
Thank you, Fiona. Can you hear me?
Yes, we can. Go ahead.
Yeah. So, hi everyone. Today I would like to share with you the Vietnam National Action Plan for responding to climate change of the health sector, state 2019 to 2030, and vision to 2050. Next, please. My presentation has 4 parts. The first one is the background, and then introduction of the National Action Plan, ongoing activities, and proposal for collaboration. Next, please. You know that Vietnam is one of the most vulnerable countries to the impact of climate change and natural disaster. Every year, the natural disaster and climate change impacts cause loss of around 2% in GDP of Vietnam. And to different evidence, we know that the health impacts of climate change in Vietnam include dengue fever, diarrhea, influenza, heat stress, hand, foot, and mouth diseases, and also the health infrastructure and equipment destroyed. Next, please. Vietnam government has committed to taking action to tackle climate change. Vietnam government already issued a national strategy on climate change response, set up a national committee on climate change response, and also in the law on environmental protection, there's a full chapter on climate change. And also the government issued the National Action Plan for implementation of Paris Agreement, and also a national target program on climate change and green growth 2016 to 2020, and update for the 2020 to 2030, and vision to 2050. Next, please. So why and how to develop the National Action Plan in the health sectors? The Vietnamese government required all ministry and provinces to update the sector action plan to respond to the climate change state 2010 and 2050 to state 2019 to 2030 and vision to 2050. And also through the implementation of the action plan in 2010 and 2050, we find many gaps in terms of the climate change and health. They include poor policies, limited resources, lack of evidences on health impacts of climate change, poor knowledge, limited capacity building and communication activities, lack of effective collaboration among sectors, and the activities only focus on health problems, not health system. So the Ministry of Health already drafted the National Action Plan, and that draft was commented by different ministries, provincial people committee, research institute, mass media, and international organizations. And then finally, in 2018, the National Action Plan of the health sectors was issued. Next, please. So the second part, I would like to introduce to the health sector National Action Plan for climate change response. The point of view of the National Action Plan is active response to climate change is crucial to protect people's health. The National Action Plan mainly focuses on environmental health, disease prevention, healthcare services, health infrastructure and equipment, disaster prevention, food safety and nutrition. And the plan implementation requires close collaboration between Ministry of Health and relevant ministry, local government, and active participant of the health workers and communities. Based on the action plan, provincial action plans will be developed and implemented. And the National Action Plan resources are mobilized from central and local budget, other lawful sources, international support, public-private partnership, and integrated to relevant programs and projects. Next, please. Objectives of the National Action Plan. Overall objectives. The action plans aim to strengthen adaptive capacity of the health sector to prevent and mitigate the risks and the impacts of climate change to the health system and human health. Specific objectives include to consolidate mechanism and policies of the health sector in response to CC, to enhance awareness and strengthen capacity of the health workers and community in climate change response, to strengthen adaptive capacity of the health system in responding to climate change with priority given to the grassroots level. Next, please. And then we also put priority actions. The first one is consolidation and mechanism of mechanism and policy on climate change and health through reviewing and assessing health facility, propose appropriate mechanism and policy on climate change response, integrating climate change response to existing sector policy, program, and plan, developing guidelines and regulation on climate change response for healthcare facility, reviewing and adding climate change responses into diagnostic and treatment protocols for infectious and non-infectious diseases, reviewing and adding climate change responses into regulation on health equipment and healthcare infrastructures. Next, please. The second priority is raising awareness of health workers and communities through the development of National Communication Plan, produce communication material, implementation of communication campaign, and then training communication skills for different groups. And the third one is capacity building on climate change response. We will develop the training material and circular for the health worker students, provision of the training for trainer, provision of training courses for professor and district levels. Next, please. Priority is the development of early warning system on health impact of climate change. We will develop the database on climate change and related diseases, mapping vulnerable regions, pilot the model or early warning system, scaling up the system, and then strengthen the climate-sensitive diseases monitoring in affected regions. The fifth priority is piloting and scaling up a success model such as the community-based climate change response model in the affected regions affected by the floods, drought, sea level rise, heat wave, and watch resilience model in community and healthcare facility, communication models, renewable green energy technology models in healthcare facility, and injury prevention models. Next, please. The sixth priority is research and assessment on the renewable and clean energy technology in the healthcare facility. The impact of we will study the impact of the climate change on health system and healthcare facility, on the infectious and on non-infectious diseases, including COVID-19. Assess the children nutrition in area affected by the climate change, and also the health impact of climate change on vulnerable people. And the last one is strengthening the health network for ensuring disease prevention, including emerging and climate-sensitive diseases. We will conduct the assessment and plan the healthcare facility network for ensuring adaptive capacity on patient collection and treatment, investment on infrastructure and equipment for district and community healthcare facilities. Next, please. So to implement the National Action Plan, the leading agency will be the Health Environment Management Agency under the Ministry of Health, in collaboration with different relevant departments in the Ministry of Health, Research and University, relevant ministry, mass and social organization, local government, and international organization and stakeholders. We estimate the budget for implementation of the whole National Action Plan is about $100 million, and the budget will be mobilized from national and local state budget, integration to the related program and project. We need the technical and financial support from international organizations and stakeholders, and we also mobilize the private sector through the public-private partnership. Next, please. And now I would like to move the section about the ongoing activities. So after the National Action Plans were issued by the Ministry of Health in the 2019, until now we have implemented several activities. The first one is climate change, the health vulnerability and adaptation option assessment to the climate change. We call VNA. The Ministry of Health, in collaboration with the university and ADB experts, to develop a set of national and provincial indicators on climate change and its impact. That set of indicators has 45 indicators divided in 3 groups. Group 1 group indicators on climate change exposure. The second one is indicators on the health impact, and indicator on the climate change adaptation capacity, including financing, administration, health system, equipment, and healthcare services. And this VNA assessment will be conducted at the national and local level by the Department of Health in collaboration with other sectors, environmental sector, financial sector, etc. Next, please. And we already conducted the policy and guideline propaganda, conducted national conference to introduce the national action plan, organized a high-level meeting with relevant department and relevant ministry and provinces, developed guidelines on the heat wave, cold wave prevention, water treatment in emergency, and water sanitation during disaster. Next, please. For capacity building, we already conducted 3 regional training on climate change and health, and set up a group of trainers, develop a training material package for 3 target groups, and also organize a training courses for more than 600 health staff. Next, please. And now we are in collaboration with ADB consultant to develop early warning system. This is a software for the medium-term and long-term early warning, and it focuses on dengue fever, diarrhea disease, and heat wave impact. And this year, the system will be piloted in some selected provinces in Vietnam. Next, please. And also, we conducted many activities for the climate change response in healthcare facilities. The first one is a green, clean, and beautiful hospital. This is initiated in 2016 by the Ministry of Health decision in order to improve the hospital environment, waste management, water supply, sanitation, and hygiene, and also the encourage the use of saving hospital to save energy and use the natural energy. And now this program is conducted in all hospitals in Vietnam, more than 10,000 healthcare facilities in Vietnam. And then last year, the Ministry of Health has initiated the plastic waste reduction in the healthcare facility through the directive and action plan. And also, Ministry of Health conducted national conference on plastic reduction campaign in health sector. That conference was chaired by Minister of Health and Minister of Environment. And the Ministry of Health is the first ministry in the country to issue the directive and have an action plan. And also, we organize a commitment signing on the plastic reduction between the Minister of Health and the Director of the hospital and different departments under the Ministry of Health. And also we organize training courses for different regions. Next, please. And through the implementation and action plan, I would like to propose some area for collaboration. The first one is capacity building on mitigation and adaptation of climate change. And the second is we already have a VNA tools, and we would like to apply the VNA tool to different levels in the whole country. We would like to scaling up the early warning system model to the whole country when it's done. And we would like to pilot and scaling up success model of the climate change response. For example, the Green and Clean and Beautiful program, plastic reduction in healthcare sector, pilot and scaling up the water sanitation and hygiene resilient to climate change in affected community. Right now, the old provinces in the central land of Vietnam are affected by the drought seriously. And we would like to pilot and scaling up the green and environment friendly technology. And the fifth area is developing a research network and sharing events on climate change and human health in the region and outside the region, outside of Vietnam. And we would like to to conduct as many as possible researches on to provide scientific evidence on climate change, air pollution, and health. So that's all of my presentation. Thank you very much for your attention.
Wow, amazing. Thank you so much, Dr. Nguyen. Incredibly inspiring. And I can see that from the comments that people in the chat that people feel the same. And it certainly does put our country, Australia, to shame to see this comprehensive vision being implemented. So thank you so much for that.
Thank you. Thank you, Fiona.
So we have a couple of questions I'm going to pose to each of our speakers, and then we'll move on to the next session. Dr. Nguyen, a question: which level of government is envisaged to have greatest responsibility for delivering the action plan? And does the Vietnam Health Environment Management Agency have any examples of public-private partnerships so far to share with this forum?
Thank you. As I mentioned, the Ministry of Health is in charge of implementation of the action plan. However, in the plans, we mentioned that Ministry of Health only cannot complete the action, cannot implement the action plan. The action plan should be implemented by different agencies, local government. Yeah, and also we need to support from the international organization and stakeholder also. And
sure. And public-private partnership?
Yeah. We already now public-private partnership policy is issued and urged to implement by the government. And for our agency, we already we already have a plan and already implement in the area of the medical wastewater management and treatment.
Okay, thank you very much, Dr. Nguyen. And Renzo, a question for you. It's a question that one could probably write several PhDs on, but I'll ask you to try and respond briefly. How can the political economic system towards the sustainable model you outlined be achieved?
Great, and indeed, I agree with you. It's a doctoral thesis topic in itself, indeed. And I'm happy you asked this question, and I'm speaking with Dr. Nguyen here from Vietnam. I just mentioned in the chat box that in a study that was conducted by the University of Leeds, Vietnam is the country that is closest to becoming a donut economy. So I think we need to all go to Vietnam and see what's happening there in the arena of politics and economics. Why are they getting it right in terms of incorporating climate and sustainability within the health sector, but also I think it's happening outside of the health sector across the board. I think my answer, apart from learning from countries that are already doing the baby steps towards it, is for civil society to really speak up. And right now it's an interesting time to be protesting and to be speaking truth to power, because we really cannot come together in the public place. But now we have the digital space, and I think, we still have a long way to go, unfortunately, for this pandemic. How can we take advantage of the new forms of connectedness that we are creating digitally in order to really deepen the discourse around the political economy that creates planetary health problems like disease and climate change? So that's my top answer. I'm sure there are many more answers when it comes to transforming the politics and the economics for the future. Thanks.
That's great. Thank you, Renzo. And I think good to make the point that it's not enough to talk, that we need to take action as well. And sometimes that is speaking out, but other actions also. Thank you very much. I'm going to hand back to Pat for a question.
Right, thank you very much, Fiona. Thank you to our keynote speakers. So now just a very quick interaction prompt for everyone. What impacts of climate change have you or your loved ones experienced? So let's try again our answers. Put them in the chat box on the right side of your screen. Now, I would like to call on the Executive Director of Healthcare Without Harm Southeast Asia, Ramon San Pascual, to moderate the panel discussion with Nurse Theo and Architect Frank.
Thank you very much to all the presenters. Very impressive indeed. And we will proceed now with some additional inputs and reactions. We have two friends to do it for us. First is our colleague from Malaysia, a nurse and been a friend from Global Green and Healthy Hospital, but she's also the Sustainability Coordinator, HCWH International Network, Nurse Theo Bing. And afterwards, we will go straight to the next response from an architect engineer that is fully engaged in helping Department of Health in the Philippines to build resilient healthcare infrastructure, and Frank Romelo will later share his thoughts on the whole topic that we're discussing in this morning. So, Nurse Theo Bing, please take the microphone, and then right away, Frank, you can follow through. Thank you.
Thanks, Ramon. Good day, everybody. I'm Billy from Malaysia. Okay, first, just like to have a quick introduction of myself. I'm actually from the Buddhist Tuti Dialysis Center. It's an NGO. And as you can see, I'm from West Malaysia. So, yeah. So, I'm from a NGO, and we have 3 centers in the northern region of Malaysia. So, we have a total about 300 over patients, and we are actually providing free dialysis treatment to the underprivileged patients. Okay, now during this pandemic, like any other NGOs in the dialysis centers, we definitely take all the standard precautions, all the preventive precautions, but mainly we want to ensure that the dialysis treatment is not interrupted, and to ensure that they continue with these medical access. And during this pandemic, a lot of people are having a lot of financial issues, and same goes to our patients here. And the first thing that, other than the treatments and all the things that necessary for our patients, we have other concerns as well, like their transport and, as, of course, their food. So we had this what we call this control movement order was on the 18th of March. We started on 18th of March, and on the 19th, our CEO team here and all the volunteers here gathered and provide food for our patients as well as for our staff. The reason that we provide these meals for the patient is to ensure that to reduce the risk of contact from going out to buy food, and of course to reduce the burden, financial burden as well. And all our food provided are vegetarian meal or plant-based meal, and all packed into reusable containers. Of course, in our mission, we also want to help the protect the environment, so there is no single-use food pack use. And at the same time, we also have a group of volunteers, mobilizing the volunteers, or what we call the community volunteers, to make PPE for our frontliners, to support them, especially during the earlier stage where we have a lot of shortages. So this is to ensure that all our frontliners are well taken care of. we also, at the same time, we have also a group of volunteers providing a plant-based diet to the frontliners as well. Okay, like anywhere in the world, there are these underprivileged groups, the homeless. So during our these what we call movement control orders, we have a group of these underprivileged homeless people. So our volunteers working together with the local council have grouped these homeless people together and provide them shelters and a place to stay throughout until today. In fact, our control movement, the date is until 9th of June. So during this period, so we provide them essential warm place to stay, meals, and to ensure that they are, safe and away from this pandemic. And for our dialysis center, this plant-based diet or vegetarian meals is part of our mission. And we have been doing and promoting this ethical eating day for a couple of years already. So this is to share with you all for early this year in January. We have been promoting this ethical eating day and plant-based diet for our patients as well as our volunteers and our staff. And this is to ensure that, we want to reduce this reduction of carbon emissions. And today, during this pandemic, this COVID pandemic, we have supported and involved in other community care. And, there is a lot of things that we cannot do. In fact, we cannot do everything. But there is, each and every one of us, there is some little things that we could do. And in our dialysis center, we hope that we are not just providing dialysis treatment. We hope that we could provide care beyond treatment, so that during this trying time, a little compassion from everyone, we could relieve and make a better place for each and every one. I think with this, I'll end my sharing. Thank you very much.
Okay, thanks for the invitation, and good day to everybody. So I will talk basically about healthcare infrastructure and about the work that we are doing for the Department of Health in the Philippines to include resilience into the future healthcare infrastructure. Next, please. So first I want to show this image, which shows all the building blocks related to climate resilience. So it is made by proposed by the WHO, and the infrastructure is only one of the 10 building blocks. So it shows us a lot of other actions that need to be done. Nevertheless, the infrastructure also is basically facilitating the medical action. All the activities will place within the infrastructure, so it's very important as well. Next, please. Then what is resilience? In a way, we see resilience as a few shells that you try to build in your infrastructure with adaptation and mitigation measures to protect yourself against, or to prepare yourself against changes and impacts of climate, society, or disasters. What does it mean? Basically, it's like try to go for a sustainable health infrastructure, but also look at backup systems. Whenever anything happens, that you're prepared and be able to continue with providing medical care. And preparedness is the people and the training. Next, please. So what we did together through a few workshops, we tried first to frame where we want to go to in the future. This is a capital investment program for the next 20 years. So where do we want to be in 20 years? So one of the first important ones is that we want to create safe zones. When anything happens, the healthcare facilities services need to be able to continue. The other thing is good practice. People can learn from good practice once they see it in the neighborhood. So the healthcare facilities should be a point of reference for the people. Also be able to function for at least 72 hours. This comes back to sustainability, but also in your systems, in your energy consumption. And probably one of the most important ones is the healthcare facilities need to be of high quality. Only high quality can assure you that you get a better health outcome. Next, please. So to be able to talk about infrastructure, you need to define all the components that have to do with the infrastructure. We adopted basically the work of WHO and the Pan American Health Organization, who developed the Hospital Safety Index, and we separated actually one component of it, which is the critical systems. Specifically, when you talk about climate change, resilience, disasters, you're looking at your critical systems. So that the critical systems, when you separate them and focus on them, you can define the standards that you need to introduce or develop within your infrastructure to be able to withstand these events. Next, please. Then the most important is in the end to propose a tool. The tool that in one way defines standards, but will lead you from your task, which is in this case, increased capacity and quality of healthcare facilities, to an implementation, that also the capacity and the quality is increased. So new health facilities or adjusting existing health facilities. This tool, which we call the Safe and Resilient Healthcare Facility Index, is helping with the different phases of the construction of new health facilities. So once you have a new health facility or an existing health facility, what you need to do is an assessment. Is the current status still okay for the future, or are there gaps? So analyzing these gaps or defining for the future, you need to so this facility index is the benchmark for the assessment of the current and new health facilities. This will lead to the definition of functional programs. What do you need to build for the future? From these programs, you can make the designs. And from the designs, you can make the construction. And construction will, in the end, lead to the implementation and will lead to increased capacity and quality of health facilities. So this is focused on infrastructure, what we can do to prevent ourselves for the future, to prepare ourselves for the future. So looking then at the COVID-19, I would say that the COVID-19 is one of the disaster preparedness scenarios, and every hospital or every healthcare facility should basically have defined these scenarios already on forehand and prepare themselves with stocks and with HR, with trainings and with equipment for this for such a pandemic. And you're looking at the health infrastructure. Basically, I think the most important is to look at the infection control and the routings to be able to have facilities that are safe for the people, safe for the the patients, let's say for the people who are working, the healthcare workers, but also that prevent further infection. Yeah, this is basically very shortly on infrastructure, what I want to contribute. And there's a lot of work to be done. And I think that the COVID-19 will basically change the looking at the quantity more at the quality of the work. Thank you very much.
I have a follow-up question just before we extend the discussion to an open forum where everyone can really participate. For billing, what are the impacts on healthcare sustainability activities during the pandemic in your own experience? And what has changed in the past 2 or 3 months of this COVID-19 crisis?
With this impact, there's of course a lot of changes, and especially there are a lot of preventive and precautionary measures that the patients, the staff have to adhere to, and to minimize the exposure and to reduce the risk. And other than our ensure that the treatment are not being interrupted, we have to ensure that all our patients follows the new norm, the changes, especially social distancing. I think it's a bit challenging for us in the beginning because, to our patients, during dialysis treatment is actually their gathering time. So social distancing is a big change for them. And we also have a compulsory for each and everyone to enter the premises to have their mask on, and strict hand hygiene and all these practices. And for our organization, patients' health and is paramount, and it's very to ensure that all the care measures are taken. So we ensure that all the necessary precautions are being taken care of.
Okay. Thank you very much. I wish we have more time. A quick question to you, Frank, and thank you for reporting what we're doing for the Department of Health in terms of resilient healthcare infrastructure. But if we widen the discussion to encompass Southeast Asia, what do you see as priorities and opportunities in terms of building or investing in climate resilient infrastructure? Frank?
Thank you, Mon, for this question. It's actually a difficult one because looking at the location of the Southeast Asia and the exposure to all the threats, disasters, typhoons, the climate change impact, you would say that try to prepare, look at preparedness, look at the facilities and try to prepare them for that they get at least be functioning for the 72 hours after the disaster to be able to continue delivering health services. But I would say in this case, also looking at the COVID-19 response, that we have globally actually a bit of a backlog in the infection control systems. So I think the priority, I would make this as a priority. So increase infection prevention and control measures in all the healthcare facilities, basically in the whole world.
Mm-hmm. Thank you. Now, Pat just cut me off if we are running out of time. I'm sure we are, but if there are additional insights from our two previous resource people, Dr. Nguyen and Dr. Renzo Ginto, I think this is the time that you can also inject your thoughts based on what has been presented by both our presenter from Malaysia, and as well as from Frank Romelo, who, by the way, is based in Netherlands. Renzo or Dr. Nguyen, do you have additional thoughts?
Yeah, I'm just thrilled listening to Biling, and it's the second time I'm listening. I've listened to Biling's and to the Tutsi Foundation's innovations in climate smart healthcare. I just wrote actually in the chat box. I think we're as the Asia Pacific community here, and I think there's so much that the world can learn from Asia in terms of adopting a climate smart healthcare framework, and the Tutsi Foundation's healthcare network, as well as the Ministry of Health in Vietnam, can serve as the mentors for the rest of the world, but also within the region. And I think what I'm reflecting on is how can we disseminate and diffuse these great pockets of innovation to neighboring countries. How can we make every Ministry of Health like the Ministry of Health of Vietnam, for example? So that's the question I have in mind, and we can have a discussion around that.
Okay, thank you. And Dr. Nguyen, any additional thoughts on the two other presentations?
Yeah. I just have one. It's not. It means during implementation of the action plan since 2010 to 2015, we already work with different international organizations and ask them to organize or set up a forum in the Asia or Pacific region to share the climate change and health prevention and response method or tool, because I really would like to learn experiences from other countries such as Indonesia or the Philippines, because we have the same impact, we have the same impact of climate change to the country and especially to the health. And also we have had a chance to visit the Griffith University and work with the Professor Kodia Chu. I saw her, she attends this webinar also. And we had a very good conference and discussion about the climate change and health and collaboration. And then after that, due to lack of the budget and many other reasons, we cannot haven't got a chance to continue. And then now, until now, I cannot attend any event on the climate change and health, climate change response in the health sector with different countries in the region. So I would like you, maybe Healthcare Without Harm or Griffith University and other organizations can set up that kind of forum or events. Yeah, thank you.
Okay, thank you. Pat, I'll bring you back the microphone. And thank you again to all the presenters. I think we will have a bit more time for some more questions from our participants. But Pat, please.
Thank you very much, everyone.
The COVID-19 pandemic, converged with pre-existing climate change impacts, has affected us all over the world. And the hardest hit are our healthcare systems, public health response, and the many vulnerable communities. We've gathered some doctors, nurses, and healthcare workers from Southeast Asia and the Pacific and asked them several important questions for the sector, starting with
COVID-19 being our fight to save the community, We are challenged not only cure the patients, but also being alert to treat our environmental footprint. We properly educate our patients to take care of our community and environmental health, because all of us, not only health workers, are taking a great responsibility to flatten the curve against the COVID-19. Finally, we must continue this spirit to recover from this pandemic situation with a new green normal habit for a better life in the future.
We must incorporate climate solution into our clinical practice, addressing concerns of our patients, staff, and community. We need to value knowledge and science in climate solutions, which support moving away from single-use plastics and prescribe plant-based diets. Stop thinking that climate change won't affect us. They do, and they are now. And stop thinking that we can't be part of the solution.
More than half of the infectious diseases that affect people are actually zoonotic diseases, which come from animals. Even before COVID-19, a lot of diseases like SARS, MERS, H1N1, Ebola, all these were caused by animals. CEPH is an international humanitarian organization whose mission is to relieve the suffering of those in need and create a better world for all. Putting compassion into action is the heart of CEPH missions, and every CEPH volunteers are actively promoting and to combat climate change and to protect Mother Earth. Master Chen Yan, the founder of CEPH Merit Society, already pledged for plant-based diet even way back in the year 2003 during SARS outbreak, because it is not only to protect the environment, but the best way to prevent being infected by the virus. Therefore, it is an effective way to mitigate this pandemic disease. Today, with COVID outbreak, which affected many countries across the world, Master Chen Yan again remind and pledge every one of us to practice and to promote plant-based diet as a way to mitigate this pandemic.
We are going through an extraordinary time. COVID-19 is a stark reminder of how prepared we must be. It has taught us many things. The lessons from this pandemic will and must only prepare us better for future response in preventing and battling the pandemics. It has taught us the importance of a good leadership and stewardship. Further, investment in our health system is the key.
Let's fight COVID.
Let's fight COVID.
Let's fight COVID.
Let's fight COVID
And achieve healthcare resilience together.
All right. So thank you very much. And to all those who participated in the video, thank you very much. We'd like to make a special mention to Miss Kinley Zam from the Health Ministry of Bhutan, who was very kind enough to join in recording this video. Now I'm passing on the mic back to Fiona for the final Q&A and then wrap up. Thank you very much.
Thank you very much, Pat, and thanks to everybody for very inspiring presentations and discussion. Now, we've got a couple of questions from the chat box I'd like to put to our speakers. Firstly, from Glenn from Noburn, Philippines. Glenn says, the Asian Development Bank recently published its recommendations on healthcare waste management that includes incineration. Our country's Ministry of Health seems to agree to the point that they have updated a manual on healthcare waste management. We know this isn't right. I assume Glenn means including incineration. What is the best way to counter their claims and arguments? I might ask for a quick response from Ramon and perhaps from Renzo as well.
Thank you
Ramon?
for asking that, Fiona, from one of our participants. What we are trying to do here in the Philippines, because ADBs seem to recommend to bring in technologies that will lead to incineration of waste coming off from COVID-19. First of all, it's not illegal. It's not legal. We have a law that bans incinerations. Secondly, we want to show that the kind of waste and probably the fear of infection brought from the waste brought up by COVID can be handled in the same manner that we've been handling waste from hospitals over the years by not resorting to incineration. Now, thirdly, we are about to do quantification of hospital waste generated from COVID-19 through a similar activity that we've been doing prior to this crisis, which is to do waste audit in hospitals. We may not need to open up the bags that contain the hospital waste, but we may be able to do some innovative ways to quantify and to show to the public, to the policymakers, to the hospitals, to the Department of Health particularly, that there is no need to resort to other ways of treating COVID-related hospital waste, but sticking to what has been established before and do no further harm by not allowing incineration. So this is the way that Healthcare Without Harm is addressing this particular question now. And we are partnering with other institutions to do this, including possibly the United Nations Development Program, and some colleagues from hospitals in the public realm, and even colleagues from the Department of Health themselves, who are not in any way believing that incineration should be the way. And you should take our word that within the DOH itself, we have very strong advocates against any form of incineration, and it can never be even justified by what's going on with the COVID, with the additional volume of related waste due to COVID-19. Thank you, Fiona.
Mon, any additional comments, Renzo?
Yeah, I want to actually expand this discussion a bit beyond incineration. I think in this day and age of planetary health, climate change, and then now COVID, for sure there will be a lot of discussion around these false solutions. These technologies that may be packaged as they're good for people, they're good for the planet, but intrinsically we know that, and science is already very clear, that they emit noxious gases and generate diseases that are highly preventable if we do not embrace these dirty forms of technology. And so I think we in the healthcare community, the scientific community, the question was how to counter these arguments. I think we just need to go back to our science and really make sure that this science is very eloquently and effectively communicated to politicians and to the public alike, not using jargons, but in a simple manner, but also really tackle, not just the evidence, aspect, but also the corporate interests really behind these technologies that are being put forward as false solutions. So we need to be scientific, but also very politically engaged if we want to make sure there's no incineration or coal-fired power plants that will remain in the post-COVID future.
Thank you, Renzo. And I want to acknowledge that we are running quite late, but we do have one more question I'd like to seek an answer to, and then we'll wrap up. And that's from Elaine Lopez, which says, my question is, how would you assess the current level of awareness and engagement of the public and private health sectors in the climate change issue, and what support can civil society actors offer to fast-track and broaden the integration of climate change in the healthcare system? I might go to, if you're still with us, Dr. Nguyen first, and then a quick reflection from Mon as well.
Hi, I would like to answer the question from Renato about the capacity building and the capacity building. Of course, we already developed the training material and organized a training for medical students at all the medical university and school in Vietnam about the climate change and health. And in terms of the regional training, that trainings, in which we have nearly 3 regional training courses for 3 countries, Vietnamese, Vietnam, Cambodia, and Laos, and organized and chaired by ADB experts. And the ADB consultant, in collaboration with 3 ministries from the Laos, Vietnam, and Cambodia, developed the training materials and organized the training courses in Vietnam, one time in Vietnam, in Laos, and in Cambodia. And the trainers are from the Ministry of Health, from the Ministry of Environment, and also from the Center for Disease Control at provincial level. Yeah.
Okay, thank you, Dr. Nguyen. And Mon, a comment from you?
Thank you again for the question. In Southeast Asia, there is a huge challenge indeed that's been presented, but also such an opportunity that is just in front of us, learning from this, our lessons from the COVID-19, and learning from the presentation, beautiful presentation, for example, of Dr. Nguyen from Vietnam, that in as much as the civil society is tasked and we have this mission to push the envelope further for the government to do better and to take up the role of governance on health, on climate, in terms of delivering basic services to the millions of people across the Southeast Asia. What we need is to envision how do we transform the healthcare system such that it is responsive to the challenge of climate health, that we are able to reduce our emission. And again, this is being shown to be doable. That it's very inspiring to hear what the Ministry of Health in Vietnam is doing and taking it down to the level of, if you heard it clearly, it goes to the level of communities. It is not a ministry work alone. It works down to where people are, to the neighborhoods. And this is where it should happen anyway, that the health is produced by the people themselves, by the families, at the level of municipalities, at the level of villages. But the leadership is required to do that. Civil society will continue to work, partner, urge, even do protests with the government who may not be as responsive. But for those governments that are responsive, such as the one being shown by Vietnam, then we will be your partner. And this is where we will work and transform this whole Southeast Asian healthcare systems to become a model of low carbon healthcare, that we are able to reduce the risk from climate change. So we have a huge challenge in front of us in the next 5 years, 10 years, but we should just do it in partnership. Thank you very much.
Thank you very much, Mon. Well, I think it's been a wonderful event. It seems a shame to wrap up, but we must. So I'm just going to provide a very brief summary to say we began with a video that reminded us of the links between the biodiversity crisis and human health in the form of pandemics and the contribution of climate change in exacerbating both biodiversity loss and worsening the morbidity from pandemics. We heard thanks and recognition of healthcare workers during the current crisis and the complex interactions between a warming planet and climate change. We heard Southeast Asia and Australia are very vulnerable to climate change. We heard an inspiring and comprehensive response from Vietnam in a cross-sectoral response being led by health to tackle, to respond to and adapt to climate change. and an inspiring example of humane and caring health services from Nurse B. Ling, showing that we can offer green and low-carbon care in ways that also empower and protect the vulnerable in our community. We got some great advice on infrastructure from Frank, some insights from Ramon San Pascual about how NGOs can work with healthcare, with the community and with government to tackle climate change and health. So I'm going to finish up there. Is there anything further, Pat, that we need to say before we conclude?
Very much, Fiona. All right. Thank you, everyone. Just a few reminders and notes. So the presentations from our speakers, including the webinar recording, will be sent to all who participated and all who registered after this session. So I think that wraps up our World Environment Day webinar special. But before anything else, is it possible for everyone to turn on their video for a quick class photo?